Well, all right. The National Coronavirus Command Council has met to deliberate on measures to take in response to this new mouthful of a COVID variant. It's XBB.1.5. Try and remember that name. It doesn't really matter what the name is, though. It is the first case of this highly transmissible subvariant that was detected down in the Western Cape. So let's get the thoughts now of former head of the COVID-19 Ministerial Advisory Committee, Professor Salim Abdool Karim. He spoke to us earlier in the week as well, saying there was no need to panic. So let's unpack this then with health expert Dr. Aslam Dasoo. Dr. Dasoo, good to have you with us on ENCA. All the very best for the year ahead as well. And here we are, another year, another variant. Should we be going into lockdown? How worried are we?
Good morning, Gareth. Good to be with you. Absolutely not. No need for any lockdown, any extraordinary measures. There's been a lot of information and a lot of hype around this new subvariant. And, you know, we've learned during this pandemic that sometimes too much information is just as bad as too little. So I think what the experts have been saying about it in South Africa has been pretty consistent. This subvariant is the Omicron variant in full, with a few tweaks to its genetics that seems to make it more transmissible. It's not an unknown subvariant. It emerged in the United States last year, and it's accounting for what seems to be the majority of infections there, and it's to be found all around the world. But I must stress that it remains the Omicron subvariant, which we are very familiar with. And in fact, it derives from a lineage that had circulating in South Africa for a long time, giving widespread background population immunity.
So we know from the reports we're seeing, Doctor, and tell me again if I've misunderstood them, this seems to be highly transmissible. I'm not sure if it's more transmissible than the other variants, but do we know about its severity? We know about this one patient. Do we know if it's more severe than the previous variants?
Well, in terms of its transmissibility, all of the subvariants have demonstrated to a larger or lesser extent the ability to have some antibody evasive properties. This one seems to be more efficient than the others, and that is why it seems to be becoming dominant. With respect to its virulence, its severity of disease, there's no evidence that it's causing more severe disease or greater hospitalization. Certainly, we're not seeing it here. In many other countries, they're not reporting it. In the United States, there is a particularly in the Northeast, 70% prevalence of this subvariant. But again, it's not translating into increased hospitalizations or death, as we saw with new variants. And I think this is important. There's no evidence that there's some new variant lurking, some sinister new variant that is going to cause surges or waves of infection. At the moment, the XBB.1.5 will probably cause perhaps more cases here in South Africa, but we don't expect that to translate to greater burden on the health system at all at this point.
Which is then where the obvious question is going to come in, Doctor, and I'm sure you knew I was going to go here. So if it's not expected to put a burden on the healthcare system, where do we stand on vaccines? Because many of us, I had the double vaccine, I forget whether it was Pfizer or the other one, I can't remember the other name, and had the booster shot. What are we doing now? Are we going for another booster shot? Are we going for a different vaccine? Just try and orientate me again.
Sure. I think vaccination has proved to be the most effective means of protecting ourselves. So we're all at idem with that. There are protocols on the number of shots one should take. What we do know is that vaccine-induced immunity, as well as naturally induced immunity, wanes over time, and therefore there has been a recommendation for booster shots. So at this point, if you've had 3 vaccinations, let's assume that you took Pfizer, the first 2, and then a booster. And if it's 6 months since then, you should be getting a second booster. For people over the age of 50, this is going into the high-risk category, and especially those with comorbidities. The Department of Health has now opened up availability of a further booster, which would give you perhaps 5 shots if you are in that category. But for most people, I think having had 3 shots now opens the door to getting your second booster. We do know that the vaccines are effective against Omicron illness. And just to say that Omicron has changed the pattern of the pandemic from a very virulent, very scary, worldwide infection to something approaching a more manageable circulating virus. And I think the emergency phase of the pandemic is not yet declared to be over. That may come later this year, depending on what happens in China. If I may just make one more point, we must be careful in this country. Over the last 3 years, our efforts to vaccinate against COVID and so on has unfortunately taken our focus away from very important programs such as HIV and TB, where we're seeing a rebound. And very worryingly, it seems that childhood vaccination has also suffered. So we have now outbreaks in 5 provinces of measles, which we haven't seen in decades. And I think the emphasis that was made by the department to increase testing for those who feel ill must be done carefully, because a lot of people are returning to South Africa or who have traveled to malaria endemic areas during the summer. And we know that there has been a real surge in malaria cases. So we wouldn't want people to go for a COVID test when they have malaria and miss that very severe illness. So it's a difficult public health situation to manage, but as long as all of the authorities are continuing their surveillance and our health systems and health workers are ready and understand the nuances here, we should be fine, and we should be able to see through XBB 1.5 without too much of a problem.
Well, I certainly hope that is going to be the case. Dr. Dasoo, I always appreciate your time. I think putting the minds of a lot of people at ease. Dr. Aslam Dasoo, a health expert, was with us since the beginning of COVID as well, and now we're at this variant. It really does come across as quite a mouthful, this XBB. .1.5, or is it XBB 1.5? It depends on who you ask these days. I'll go with the experts. Dr. Dasoo saying XBB 1.5. It might be a bit easier to remember. So just to summarize, if you've had your initial vaccinations, I had my 2 and I went for the booster shot. If it's been 6 months or more since your booster shot, it's advisable for you to go get another booster shot with this new subvariant. And I suppose the big takeaway is for anybody with slightly older parents or anybody over the age of 50, especially with comorbidities, certainly to go back and see if you can get yourself a booster shot of some kind.